Hello, my name's Margaret Hellard. I'm Head of the Centre for Population Health at the Burnet Institute and Head of Hepatitis Services in the Infectious Diseases Unit at the Alfred Hospital in Melbourne. For the last 20 to 30 years I've been undertaking work to stop people from getting infected with hepatitis B and C, and also in those people who are already infected, ensuring they have high quality clinical care. Hepatitis B and C cause considerable unnecessary illness and death in people in Australia. Both diseases can be prevented and both diseases can be managed in a way that makes it that people should not get ill. Over the last 20 to 30 years I've been involved in research that has tried to prevent people from getting infected with hepatitis B and C. Ways that we can do that is improve people having vaccinations and also ensuring there are clean needles and syringes available to anybody who needs them, who injects drugs. There are other ways to do this as well that can be improved. An important aspect of it is that if people are infected with either hepatitis B or C, is that they're actually aware that they're infected. We don't have enough testing going on and we need to make sure this improves, and we need work and further research and efforts to have this happen. Similarly, in people who are infected with the viruses, we need to ensure that they have high quality clinical care in places they need it. I undertake a lot of research and work within the community to ensure that we can provide services that are appropriate, that are adequate, and that address the issues for these people. Hepatitis B and C can be treated. Hepatitis C in particular over the next 5 years can be cured. We need to make sure this happens. As a hepatitis hero, there are two key things I would like to highlight. For people who are infected with hepatitis B and C, I think it's important that you're aware that there are now quality treatments available for you to keep you well, and in particular for hepatitis C, to cure you of your infection. Over the next 5 years, there will be marked changes in how we can manage hepatitis C, and it's important that you begin to get care and assessed right now. For people in the community who are not infected with hepatitis, it's really important that you recognise that your attitudes towards hepatitis impact on people with these infections. There is stigma associated with having hepatitis B and C, and this means people do not take appropriate care and follow-up of their disease. It's important that you take action, that you make sure that you're not a person that causes somebody with these illnesses not to seek medical care. We all have a responsibility to reduce the stigma associated with these infections from now.